Welcome to our first lecture of evidence-based dentistry. So the reading for this chapter, or for this week rather, is chapter 1 and also chapter 3. And what this whole lecture is about is this word over here, evidence-based dentistry. We're going to look at what this really means. So everything we do in clinic is backed up by evidence-based, which basically means that anything we do in clinic, whether it be taking x-rays, whether it be debriding, whether it be polishing, whether it be applying fluoride, we're doing that because there is evidence to show that it works. So we're not doing it just because. We're doing it because there is evidence to show that it works. There is research done to show that it's effective. So the way evidence-based practice works is that it looks at three things. And the three things that it looks at is there research to show that it works? It looks at our experience. Do we have the experience? Have we seen with our own eyes that it works? And then client values. Does the client want it? And I'll give you an example. So again, these were the three things that evidence-based decision-making model looks at. Let's look at debridement. Is there scientific evidence to show that debridement works? Is there scientific evidence to show that when you debride, the mouth will get healthier or you'll get less bleeding? And yes, we know that there is evidence that when we debride, the chance of them, getting periodontal disease is less. In our experience and in our judgment, do we see that with debridement we're getting better tissue response? Is their mouth improving when we debride? And we know that, right, with experience, because when we debride our clients and then they come back for the 4 to 6 week re-eval, we see a tissue response, a positive tissue response, right? We see that change. So yes, we have experience in knowing that debridement helps. Client preferences and values. Does the client want a cleaning? Does the client value their cleaning? If we put a check mark on these three boxes, then what we have done is evidence-based decision making. We have made a decision based on evidence-based. Let's look at another example, polishing. Is there scientific evidence to show that polishing works? And you can check mark this box or this circle if you have evidence to show that polishing does work in removing stain. And I think we all can agree. So we will put a check mark on this circle. Do we have the experience and judgment to know that polishing works? So when we're polishing teeth, have you seen stain come off easily? If you put a check mark here, then it means yes, you agree that in your experience, polishing helps. Does the client want it? Does the client believe that polishing will help remove his or her stains? You put a check mark here, then that means you have 3 check marks, which means that you have implemented evidence-based decision making. So everything we do in clinic is backed up by these 3 boxes or these 3 circles. Fluoride. There's evidence to show that fluoride helps reduce cavities and sensitivity. In our experience, we have noticed that when we apply fluoride, the clients have less cavities and the client sensitivity is also reduced. And the client has also noticed that when they get fluoride done, the chance of them getting cavities is less, and the sensitivity part may help as well. So as long as all 3 sections are met, it's evidence-based decision making. And it's not only dentistry, medicine does it too. So doctors and nurses, they use the same 3 categories to make their decision. This over here is showing that where can we go to find research? Where can we go to find the best scientific evidence? The best place to go is to find a paper that is a systematic review. Now, I know this may not mean anything to you right now. We'll have a whole lecture on what a systematic review is, but just to give you a gist, a systematic review is when a researcher does research on a topic, and when he does this research, he finds the top 15 or the top 20 or the top 100 really, really good articles, and then he combines all those 100 articles and puts it into one paper. and he talks about it. So a systematic review is basically a review of like the top articles that are out there pertaining to the topic, and then it's just a written review about that topic. And they find the best studies that are out there, and they compile the results in their paper. So that's a systematic review. Again, don't worry too much about it. We're going to talk about it in a lot more detail later on. But if you find research and that research is a systematic review, then that's really good. The bigger the circle, the better. Randomized controlled trials, RCTs, are also very good. It's an experiment where randomization is happening, and again, we'll talk about that later on. Textbook, you can see the circle is a little bit more smaller, and that's not to say that it's horrible. It's not a horrible. I don't want to say that it's a horrible place to go to get information. What I want you to know is that textbooks are a great source of foundational knowledge. However, by the time the textbook gets published, the information in the textbook could be outdated, because it takes 2 to 3 years for a textbook to get published. That's a long time. And within that 2 to 3 years, things could have changed. So that's why the size of the textbook is smaller. Expert opinion, yes, someone's opinion is valuable, but it's not as strong as a systematic review or a randomized control trial. Okay? Your own knowledge, sure, I mean, it could be, but you want to back up your own knowledge with some systematic reviews or randomized control trial. So the gist of this is that the bigger the circle, the stronger the evidence you have. The smaller the circle, like someone's experience, that, isn't as credible. So this is just a flowchart of how research works. So the first thing you do is you come up with a question. So let's say you have a client or a child. Let's say you have a child in the chair. Let's just assume this child is 6 years old and she has a cavity, so she's getting local anesthetic, and now that area is numb. The dentist did the fillings, and she's about to get home or go home. And now the mom tells the dentist that, when she goes home, I know that she's going to bite her cheeks, and I know she's going to wake up tomorrow with like so many sores and so many bite marks in her cheek. So the dentist was like, well, maybe what we could do is we could use something called Oraverse. And Oraverse is an anesthetic that you put inside so you inject it again into the mouth, and what it's supposed to do is reverse the numbness. So let's say the dentist is interested to see whether Oraverse would work on this client and reverse the numbness. So that's the question. The question that the dentist has is whether Oraverse would work in reversing the numbness. So the dentist would conduct research and hopefully find lots of systematic reviews to show that it works. Once the dentist finds out that it does work, the dentist can disseminate the knowledge or spread the knowledge, and they could spread it by writing a journal article, about it. They could spread it by talking to other coworkers. They could spread it by holding a presentation about, Oraverse. And then they would utilize these findings in practice, so they would use Oraverse in the clinic. And the goal is to improve the quality of care. And the goal is to improve the quality of care for that little girl, in the sense that hopefully now because she got her feeling back, she won't be biting her cheeks. As an FYI, Oraverse has been recalled. So in April of 2018, they had to recall this drug. And so since then, it hasn't been used. I'm not sure if it has come back, but I know in April 2018, they did recall this product. Okay, so other things to note is that when you are making a decision, or rather an evidence-based decision, there are things that you should look at. So yes, we should look at those 3 sections, right? So research, clinician experience, and client's values. But you also want to think about when you're looking at the research category, you also want to make sure that the research findings are really, really good. The research findings are selected and analyzed according to excellent guidelines, according to strict guidelines. There are good research out there and there are bad research out there, and we're going to learn the difference between good and bad. But you want to make sure that the research that you found follow extremely strict guidelines, and basically you want to make sure that the research that you found is excellent research, is really good, really credible research, very minimal bias. And again, next week we're going to learn more about how to know whether a research is good and whether a research that you're reading is bad.